We are having another medical condition for discussion today, and today we are going to talk about acute Guillain syndrome, which is an undesirable disease, which is a disease of public health interest, and which is a disease of concern by WHO and every nation experiencing in Sub-Saharan Africa. They are concerned in this disease because it is one of the diseases which causes a permanent paralysis. It's a disease which causes permanent paralysis, so it is very important for this disease to be discussed. To be discussed. It's a very rare disease which occurs in around 1 person in every 1,000 people. So it's also a rare disease, not all that, but all diseases are all like that. So by definition is that acute is an acute, subacute onset progressive paralysis. Reflex paralysis often preceded by a recent infection associated with paresthesia. So when you are taking the history, you ask the questions whether there was a history of what, there was a history of recent illness. So it is also called acute inflammatory and emulating polyneuropathy. It's also called acute inflammatory and emulating polyneuropathy. So this disease happens because of the exposure of the nerve fibers, the exposure of the nerve fibers. When there is a destruction of the meridian, meridian is the seed which protect the nerve. So if the meridian fibers is destroyed, so the nerves is unable to transfer impulses to the point of respiration, so that causes that the nerve impulses is affected because this one, the nerve is exposed when the seed which protect it is what is destroyed, and this one results to problems and pathological conditions or what weaknesses on the lower ribs if it wasn't there, or difficulty in swallowing if it was going to affect the upper GIT, or shortness of breath breathing if that nerve was going to taking the innervation to the respiratory system, especially the lungs. So basically, that is how this pathological way of this disease comes about. So generally, is a neurological disorder in which the body immune systems attacks the nerve, affecting the seat which protect the nerve, exposing the nerve, so the nerve is unable to transfer impulses to the system point. So the median seat and the nerve is damaged for weakness and differentiation. So it starts from your feet and hands first, and quickly spread eventual paralysis and the whole body. Later on, you will see the progression of the disease and the features which are good to diagnosis, and also the risk factors of the disease. So there is predisposing factors like infection, like corrupt bacteria, infections like Zika virus, influenza viruses, cytomegaloviruses, hepatitis A, B, C, and E, and also Epstein-Barr viruses, mycoplasma pneumonia, and trauma, surgery, and Hawkins lymphoma are one of the risk factors which can predispose you to this type of disease. So the cause is not well known, but it is associated with the Campylobacter bacteria, most common, and also associated with the respiratory infections, also associated with the gastrointestinal infections, and also postoperative Guillain-Barré syndrome can also be associated with this one, or coexisting with the conditions like systemic lupus erythematosus, which is autoimmune disease which destroys almost all the part of the body. So the symptoms are like bilateral placid limbs weaknesses, and there is reduced or loss of tendon reflexes. And there is tingling and weakness starting in the feet and legs and spread quickly to the upper part of the upper body and arms. There is unsteady walking. When patient or something around, there will be unsteady walking. The gait cycle or inability to walk or climb stairs. It is also associated with the impaired vision if it affects the optic nerve. So a severe pain that may feel like itchy, shooting, and maybe worsening at night, and so it can also cause to irregular blood pressure because of the autonomic nervous system which controls the the endocrine system, and also the autonomic nervous system, sympathetic, the parasympathetic, which controls the blood pressure, about the beta and alpha energetic receptors. So it can also cause difficulty in difficulty in physical movement, such as speaking and swallowing. The pathophysiology is that normally there is destruction of the seed which protect the nerve, either due to an immunological problem or a foreign particles or body or microorganism invading the body. There is well in these conditions starts. So it is destroying the nerve is exposed, and which surround the axons, so the cells are exposed and they are unable to conduct the what? They are unable to conduct the impulses. So when these exerts, the cells is unable to send signals effectively, and the deficient muscles or part of the body does not respond to the command receiving from the body, and it receives via sensory signals. So this one result in ability to feel it, pain, and sometimes other sensation. So the investigations are either you can do rubber puncture to see the spinal tap, the spinal fluid you do in the spinal for investigation. You can do it for autoimmune like cytokines. You can do serological tests, and you can do chemokines. All those things you can do human leukocyte antigen, specific antigen. Like you can do toll-like receptors, and also another one is you can do electro and diagnosis as a way of investigations. So let us see the diagnostic features of this Guillain-Barré syndrome. So features required for diagnosis of these diseases, there is supposed to be progressive motor weaknesses of more than one limb, aphrexia or marked hypophrexia. There should be features strongly supporting of the diagnosis is progressive over 4 or over days more than less than 4 weeks. There is supposed to be a relative symmetry. There should be pain often significant at onset. There should be a middle sensory symptoms or signs. There should be a cranial nerve involvement, autonomic dysfunctions, absence of fear at onset, of fever at onset, and onset of recovery 2 to 4 weeks after onset of peace. So there are laboratory features for making this diagnosis is elevated cerebrospinal fluid proteins after 1 week symptoms, and also there should be less than 10 leukocytes in the cerebrospinal fluid. Slow conduction or conduction block on electromyogram. So if there is a slow conductions, that one also in diagnosis. So that one also in diagnosis. So factors that cast doubts when your diagnosis this GBS or Guillain-Barré syndrome is marked persistent asymmetry of motor function, or persistent bile or bladder dysfunction, discrete sensory level, cerebrospinal fluid parasitosis of more than 50 cells per milliliter, cubic ptosis, pupillary abnormalities, prominent bulbar signals, and descending weakness. These factors they cast doubt. If you see this one, you start now doubting whether this is what. You start looking further. You have to look for another disease. You have to look for the differential diagnosis if any of this one is there. The other one, let us look at the differential diagnosis of this disease. The differential diagnosis is like in the central nervous system, it can be either hysterical paralysis. In the cerebellum, it can be either due to acute cerebral ataxia. In the spinal cord, it can be either transverse myelitis or spinal cord compression. In the anterior horn of the cell, it can be either polymeritis. In the peripheral nerves, it can be either T paralysis, which is very common in the United States of America, then toxic neuropathy, diphtheria, apoplea, and then neuromuscular injections can be either botulism, myasthenia gravis, T paralysis also in Australia, affecting neuromuscular injections, then neuromuscular blocking agents, and also in the muscles can be either viral myositis, inflammatory myopathitis, and metabolic myopathitis. So those are the differential and diagnosis of the disease. So those are the different diagnosis of this disease. So let us look at the treatment. The treatment is depends. It's more of rehabilitative because you prevent it's not curable. So the goal is to prevent breathing difficulties and breathing symptoms. So you drug used to relieve pains, killers, and other conditions may be present. So the mode of treatment can either be conservative, operative, or drug therapies. And the drug therapies, you can do a plasma paralysis or immunoglobulin to suppress the immune system and reduce inflammation caused by the immune system response to cells. So plasma paralysis is like dialysis, but this one now you want to remove the cell and part of the cell and the antibodies, the antigens which are in the body, and also something like dialysis where the blood is creamed and so we have seen that the plasma paralysis is where the plasma is removed and diffused with other fluids in the body to remove the antibodies which are causing this problem of the destruction of the seed of the nerves. So also you can do immunoglobulin therapies, which helps decrease the immune system or nervous system. So conservative management involves therapies such as mono and physical therapies, physiotherapy, and then patients who are hospitalized to increase muscle flexibility and strength. Hormonotherapy is done to help in the regulation of the body metabolic and regulation of the body hormones. So palliative is done in complicated condition and in the severe form of GBS syndrome. So the complications can either include pressure ulcers, deep vein thrombosis, bulbar palsy, permanent paralysis, dietary deficiency, and hyponatremia. And also it can cause renal failure. It can cause renal failure. Thank you very much for listening to this one.